You know that feeling when someone you love seems so distant, even when they're right there with you? It's like they're on one side of a deep, wide canyon and you're on the other, just wanting to reach them. But how? Well, in this explainer, we're going to talk about exactly that. We're going to learn how to build a bridge using the compassionate wisdom of consultant psychiatrist, Dr. Phang Cheng Kar. It's a bridge of support and understanding to help someone you care about find their way to safety. And first, it is so important to know that this is a journey many people are on. Just to give you a sense of the scale here, the 2023 National Health and Mobility Survey found that about 1 million adults in Malaysia are living with depression. That's not just a number, right? These are people in our communities, in our families who are struggling. It's a powerful reminder that you and your loved one, you are truly not alone in this. And when we look at our young people, the need for our attention becomes even clearer. In 2022, nearly 27%. Think about that. That's more than 1 out of every 4 adolescents in Malaysia met the criteria for depression. This isn't just teenage angst or a passing mood. It's a serious call for our care and for our support. Now, if we dig a little deeper into that number, we see a really important story. The experience of depression isn't the same for everybody. For young women, the rate is significantly higher, more than double that of young men. We're talking 36.1% compared to 17.7%. Knowing this helps us to approach every single person with the kind of compassion that their unique situation really needs. Okay, so why is it so incredibly hard to ask for help? Let's go back to that idea of the canyon. It's what isolates the person who's struggling from the help they need. And this canyon, it's created by all sorts of things, isn't it? Things like social stigma, a real fear of being judged, or honestly, sometimes it's just the overwhelming exhaustion of not even knowing where to start. So let's get really clear on what we're talking about. Major depressive disorder, it's not just the blues or feeling down. It is a recognized severe medical illness. It quietly worms its way into everything, how you feel, the way you think, and the things you do. But listen, the most important part of this entire definition, the real heart of it, is that last part. It is treatable. There is hope. And that brings us to the very foundation of the bridge we want to build, this core idea from Dr. Phang Cheng Kar. Let's just let it sink in. Depression is not weakness, it's an illness. This changes everything. It's not a flaw in their character. It's not a lack of willpower. It's an illness, plain and simple, and it deserves the exact same care and compassion we give any other medical condition. So where do we start? How do we begin to build this bridge? Well, the very first materials we have are our words and our mindset. The way we open the conversation can either make that canyon feel wider, or it can lay down the very first solid planks that lead to connection. And Dr. Phang gives us such a powerful way to reframe this. Instead of seeing weakness, see this. Having depression doesn't mean you are weak. It probably means you have been strong for too long. Wow, what a shift in perspective. It validates their struggle. It honors their endurance. It's like saying, I see how hard you've been fighting this battle all by yourself. It's okay to let someone else help carry the weight now. You know, sometimes the word depression itself can feel really big and scary. It can make someone put up a wall immediately. So it's totally okay to use gentler language to start the conversation. You could talk about an emotional flu, or maybe just focus on what you've actually seen. Hey, I've noticed you're not really sleeping well, or you seem to be under so much stress lately. Remember, the goal isn't to be a doctor. It's to be a friend. It's just to open a door. A bridge is useless if it doesn't feel safe to cross. So how do we create that safety? Well, we can promise them that what they share is just between us. We can help them feel less alone by gently mentioning that so many successful, amazing people have walked this very same path. If you feel comfortable and it feels right, sharing a little bit of your own struggle can be an incredible connector. Or you can just suggest a really safe, small first step, like chatting with a family doctor they already know and trust. All right. So once we've laid down those first planks of trust, we can start to make the path forward a little smoother. This next part is all about those gentle, practical actions that can remove some of the obstacles and make the whole journey just feel a little less scary. So where does this part lead? Well, there are usually two main starting points. Now, the ultimate goal might be getting specialized care from a mental health professional. But honestly, starting with a familiar family doctor, a GP, is often a much easier first step. It just feels more like a normal checkup, and that can take a lot of the fear and stigma out of the equation. Your loved one is probably going to have some very real practical worries, things like how much is this going to cost? Or how long will I have to wait to see someone? And it's super helpful to know that there are different options. Private services are generally quicker, but they cost more. Government services are way more affordable, but there might be a bit of a wait. Knowing this means you can help them figure out a path that feels manageable for them. And remember, true support is so much more than words. It's about what we do. When a person is deep in depression, even a simple task like making a phone call can feel impossible. This is where you can be their co-pilot. Offer to help them book the appointment, drive them there, sit with them in the waiting room. These things might seem small to you, but they send the clearest message possible. You are not doing this alone. I am right here with you. As we start to wrap this up, I really want to land on the single most important part of this whole process. It's not a specific therapy. It's not a certain doctor. The most powerful, most healing element in this entire picture is you, your love, your patience, your simple presence. You are the bridge. And this final piece of wisdom from Dr. Phang just says it all, doesn't it? When we understand, we can care more effectively. Notice the word isn't fix or solve. Our job is to first try to understand what they're going through. When we lead with that kind of empathy, when we try to feel what it's like on their side of the canyon, that's when our care becomes truly powerful and healing. Please remember, a bridge like this isn't built in an afternoon. It takes time, it takes patience. There are going to be good days and there are going to be really tough days, but your gentle, steady, non-judgmental support, that is the strongest steel you have. It's the foundation that will help them cross from that place of isolation to a place of hope. So I'll just leave you with this one question to reflect on. Think about the person that's in your heart right now. What is one small, gentle step you can take today to just begin laying that first plank of the bridge? Maybe it's a simple text saying, thinking of you. Maybe it's just offering to sit with them in silence. Whatever it is, please know that your one compassionate action could be the start of everything.